Thank you so much. I would like to take this opportunity to thank you all who are present here, and my first-hand and experience I'll share, and insight, and as well as activism, as well as of my youth leadership here in Malawi. I will share my screen. Can you see my screen?
Yes, we can see your screen.
All right, thank you so much. I will be presenting harnessing youth engagement to address sexual reproductive health through SSTC in post-COVID era. My youth engagement here in Malawi. First of all, Malawi's national population is projected at 17.9 million, with 73% being young people under the age of 30 and 32 comprised of young people aged 10 to 24. That is Malawi Youth Status Report 2015. This youthful population is acknowledged as being one of the Malawi's strongest assets. However, young people in Malawi are faced with a number of socioeconomic challenges that may affect the realization of their full potential. One area where young people are greatly affected is sexual reproductive health. Moreover, the coronavirus pandemic has exhibited existing barriers to access to sexual and reproductive health services for young people, as funding for these services was being debated to address the pandemic that is to increase the number of teenage pregnancies, child marriages, and gender-based violence among young people, especially adolescent girls and young women. So status of South-South and triangular cooperation. Malawi, just like many other developing countries, have set national development agendas to achieve over some years. We have the Agenda 2063, which looks at a holistic approach to development that leaves no one behind, and there is a special national youth strategy to be achieved by the year 2063. Already, we have seen knowledge exchange working between nations. A multinational 3-year sexual reproductive health project for Malawi, Mozambique, and Ethiopia, Her Future, Her Choice, facilitated by Oxfam, was successful. We also have appreciated the academic project by ICY African in more than 4 countries being successful, where community development leaders are trained and they undertake visits for knowledge exchange. Also, my intervention on Malawi sexual reproductive health. In Malawi, most of sexual reproductive health interventions are implemented by youth organizations, youth lead or women lead organizations. Mostly, these organizations operate at local NGO or district level, and they don't satisfactorily deliver the entire sexual reproductive health package due to knowledge gap, lack of funding, and policy restraints. But these organizations are trainable. They are willing to learn and get small grants to strengthen their capacity. Trainings can help fill capacity gap, that is resource mobilization, proposal strengthening their capacity, and development system and policy development. Such skills can be social enterprise, which in the short and medium term can help the organization grow. Youth-led organizations are preferring better structured arrangements like international organizations partnering with local organizations for better results. Youth and as well youth-led organizations should also use peer learning so that they successfully implement sexual reproductive interventions. A good example is Girls Empowerment Network, that's Janet, where a number of youth and women-led organizations came together to pool their expertise and resources together to advance feminism, sexual reproductive health, and ending violence against women and girls. What I'm doing, advocacy and activism in Malawi, there have been countless advocacy initiatives that have been launched with the aim of deciding how the needs of adolescents and young people can most adequately met. In regards to sexual reproductive health, though significant progress has been made in the development of strategy and policy document, development of programs and reviewing of laws, the needs of adolescents and young people continue to be neglected at all levels, in policies, in programs, and interventions. Changing the narrative requirements requires a coordinated effort, as reported by the National Youth Engagement on Sexual Reproductive Health. Yes, the only main challenge that we face here in Malawi is to openly advocate for rights of minority groups like LGBTIQs, as our culture and region seem to be hostile on the activism and the key population. This requires an extensive national advocacy campaign lobbying for equality and inclusion of the minorities. Thank you so much. Over.